to our panel discussion on mental health services available in Western Racine County with a special emphasis on children's mental health services. I'm Pat Boheim, President of the Board of Directors of NAMI Racine County. And on behalf of our organization, we'd like to thank Lori Radke and the Burlington Area School District for partnering in the organization of this informational panel, which obviously is both a live event and also will be available for future broadcasts. We have an esteemed group of panelists with us this evening who will share important information on their different organizations and services throughout the county. We're being joined today, and I'll start to my far left by Amanda Busick, the Public Health Strategist, Racine County Public Health Division. The Racine County Public Health Division is responsible, as you may know, for providing public health services to many communities in Racine County. Their mission is to improve the health of communities we serve through health promotion, disease prevention, and protection from health and environmental hazards. The Racine County Public Health Division monitors the health concerns of entire communities and aims to prevent health problems before they occur. We're also joined by Dr. Mervyn Langley, who works with children and adolescents through Auroral Behavioral Health Services, or Auroral Behavioral Health, I should say. He has extensive knowledge on a variety of mental health disorders, such as ADHD, anxiety and depression, ODD, as well as effective research-based treatment strategy. Dr. Langley's knowledge has come from earning his doctoral degree, working as a research coordinator, being a part of various research grants in a long-term research study, and through publishing multiple journals, articles, and book chapters. And we're also joined by Mr. Carlos Frick, who's the Communications and Advocacy Manager for NAMI Racine County. He is actually here to talk a little bit about a couple of the educational programs and support programs that NAMI Racine County offers geared toward youth. Our Ending the Silence program, which is an education program offered in schools, as well as our youth support group, Teen Talk, which is recently launched in Western Racine County. And Carlos is a last-minute substitute for our outreach coordinator, Sherry Hess, who was unable to attend this evening. As we all know, mental health is an important issue that affects individuals and families across our community. We hope this conversation will shed light on the resources available to those who need them and help break down barriers to accessing care. And obviously, we're looking forward to hearing from our panelists and then also addressing any of your questions. And Carlos, what's our order at this point?
I'll start, and then we'll go with Amanda and then Dr. Langley.
Very good. Mr. Frick.
I'll have this shorter part. So, NAMI Racine County is, NAMI, first off, is the National Alliance on Mental Illness. And we have been in Racine County trying to expand our services. On this side of the eye, or on the west side of the eye, we have Sherry Hess, who is our outreach coordinator, has partnered with different groups to try to bring programs to this part of Racine County. One of the main programs that we have right now is Teen Talk. Teen Talk started here in west of the eye, in the library. There's a group of teens that were meeting already there, and so they partnered with us to create this group. Teen Talk is basically an open place for teens to talk about their concerns. They could be family concerns, they could be mental health concerns, and it's not a place for counseling. It's just a support group for teenagers. It is led by 2 adults, but these 2 adults are simply there just to monitor the situation. They're not intervening with the talk. The idea is that they feel comfortable enough and open enough to talk about what might be concerning, and that could be anything. Teen Talk meets again at the library every third Thursday from 3 to 4:30. And we're always looking for more students and more youngsters who want to join and be part of these conversations, because obviously it's something that is needed, especially in the teenage years. The other program, and this is a big educational program, is called Ending the Silence, or ETS. ETS is a program that it is about 50 minutes, and it is a presentation that Chair Hess does in schools. And actually, the way it works is that usually school districts or schools themselves, teachers who would be interested, would contact us and schedule a presentation. And ETS is a presentation about the science of not necessarily mental illness, but mental health concerns. We know that mental health concerns usually develop in the teenage years. So this is a middle school, high school type of presentation. The idea on ETS is not just to have a presentation, but also to have a follow-up with the students. They might feel that some of the things that are presented touch them, that it's happening to them. So it's giving them the opportunity to look at this plethora of, it's teenage years, so everything is difficult, but there might be something that resonates with them, and so that they can follow up. It's not just to talk about signs of mental health concerns, but it's also to know what to do if you feel identified with some of them. It is also, this is a research-based presentation, so it also has notably increased the positive way how students look at their own mental health and the mental health of their partners or their classmates. It is also a presentation that allows youth to see the signs of depression, suicide prevention. So it is, as I say, it's a very touching, very well presented 50 minutes conversation that opens the conversation that will follow later in the classroom probably, or in groups like and again, that's Sherry would have done a much better job introducing all this information, but she unfortunately could not be here. However, if you do want to get more information, you can go to our website, www.namiracine.org, or you can actually email Sherry, Hess@NAMI Racine County, and ask for more information, or even go to our website and schedule a presentation for your school. Okay.
Thank you very much. Amanda?
Again, Amanda Busak from Racine County Public Health. There's a few things that the county offers as far as, or county public health offers as far as mental health. So typically where the public health department stands is we're a little bit further removed from that direct patient support, direct client support, right? So we're looking at kind of that population health, we're more on the prevention side of things. However, we are so deep in this mental health crisis that we're trying to not only address what's happening now, but also get ahead of it. So there's a few different areas where we dip into help with mental health. And this has been a priority area for Racine County Public Health for several years. So we'll continue to work on this as we develop our next, we're in the middle of developing our next community health improvement plan, which is essentially our plan for the next 5 years. And mental health has been an overwhelming priority for all of the partner agencies involved in that plan. So to start with youth, I did want to give a little bit of an update. So we're just starting to get some new data rolling in from the youth risk behavior surveys. And we're seeing for the first time in decades that there's been an increase, a significant increase in youth suicide attempts and suicide deaths. So typically those deaths are more adult male than anybody else, and we are starting to see the numbers for the youth groups go up. So that's concerning considering it's been small increases or stagnant for a very long time. So in particular with youth, what we've started new this year is offering QPR trainings. So that's question, persuade, refer. That is an emergency kind of intervention, emergency response for people. And really anybody can be trained in this. So essentially what we would do is come in, we can teach staff, other students, any support group, people that we have on campus. how to identify signs of suicide risk. And then once they identify those signs, what questions do you ask? How do you respond to somebody? How do you make a referral? How do you just have that conversation? It can be very difficult even when you know the right things to do. So it's essentially a gatekeeper position to be in. The idea behind that too is not just having, a select few staff trained or, having it only be the nurse or administration, but as many people on school campus as possible, having eyes on those behaviors that we're looking for, being able to ask the question. If it's a student, they may not be comfortable going to someone of authority and saying, hey, I'm struggling, but it might be a peer, it might be a teacher that they see once a week. So making sure that we have a lot of those individuals trained and ready to identify issues and make referrals if needed, especially for our kids. So that is one offering that we're doing. Those trainings are about 60 to 90 minutes. They can be flexed. We can do smaller groups or larger groups, and certainly do it in stages. If you want to just start to roll it out with one building to see how it goes, we can do that. And then along with that, we do also do a lot with 988 awareness and trying to make sure that people know that that is a resource. So we have labels available. You can either have them printed on badges, or you can have them printed on labels, posters, keychains, really any way to get this out in front of everyone. With 988, the nice thing that you can do is call, text, or do an online chat. So it's very accessible, especially for a lot of our students who don't necessarily want to pick up the phone and make a call and talk to a live person. You can just text, and it's super easy. The other thing that I like to bring up with 988 is we call it this crisis service, right? You call a 988 when you're in a mental health crisis. It does not have to be a life or death scenario. It can be, I'm feeling overwhelmed and anxious. I'm feeling depressed and I'm not sure what to do with that. And you just need a little bit of support on what to watch for, maybe what to do to get back on track. And it's also a really great resource for support people. So teachers, parents, loved ones. I could text in and say, I'm seeing these signs in my daughter or in my husband, and I'm not sure what questions to ask or what to look for. What resources can I find? And 988 will walk me through text, chat, or call how to be a support person and what to look for. So it doesn't have to be just a moment of crisis that you're calling or texting, or the individual that actually needs the help doesn't even need to be present for that. So super important to know that there's a wide variety of services that they provide. They do connect with local services as well. So it's something if I call in from Racine County, they can connect me back with local services. I might get Racine County crisis, behavioral health can come out. So they're very well connected locally as well. There is also a new warm line that launched earlier this year. So again, for those people who aren't necessarily in crisis but need a little extra support, that warm line is available 24/7. And we are finding more national services, especially with the need for online connection, more national services that are specific to people that live in rural areas, farming families, things like that. So continue to watch from the health department, social media primarily, or our website, and we will continue to post lots of virtual support groups. We're working a lot with NAMI on their events that they have coming up. So just trying to get these different services and events out there for people to see. The other big initiative that we launched this year is man therapy. So obviously targeted a little more towards our adults. But one thing I always like to bring up is for men's mental health and suicide rates, what we see is 2 points of transition. So typically, and again, like I said, we're seeing more an increase in younger or teenagers having suicide attempts and suicide deaths. But typically we see an increase around the 18 to 24 age group. So coming out of high school, entering the workforce, big life changes, we're seeing an increase in suicide attempts and deaths there. And then again at retirement age. So now you've done your career and you're transitioning out. We teach you what to do with your finances, and we teach you that your benefits are changing and how you have to take care of your health. But we don't address the fact that your entire purpose has been shifted. Your whole lifestyle and routine is flipped upside down. So we see another significant increase around that age 65, and typically that's very closely linked with firearms as well. So Man Therapy is a program, it's a platform online, 24/7, anonymous, free, accessible to anybody, focusing on the working age man. What we want to do as far as our youth is make sure that we're bringing that attention to these resources around high school graduation time, around time that they're starting to take on more of an adult role, more responsibilities. They're leaving the safety net of high school and safety net of home and moving into either college or the workforce, right? So what we do with Man Therapy is just try to bring it in a way that is, it's humorous, it's lighthearted. They use the stereotypical male traits, a lot of stoicism, a lot of jokes around manly behaviors, and we try to just lighten the conversation up so it's not so cold and clinical and so much about your feelings. we'll get there. We'll talk about the feelings. There is a mental health assessment on the website. But the goal is just to really use the humor, address the fact that there's stigma, that there are barriers for men to seek help, but use that, make it funny, make it light, and yes, let's talk about, why are you anxious, why are you depressed, and how can we get you help? We do know that in general, men are not typically the most help-seeking group, so this is a platform for people to go on and do an assessment, get some resources, learn more about what is anxiety and depression. There's a lot of tips around finances, relationships. There's a lot on divorce on there, different work, so like construction, agriculture, first responders in particular. There's a lot of different specific tips for those groups. And then once you're ready, there's Racine County resources. So this is a great do-it-yourself at-home platform. And then once you're ready to connect and maybe talk to somebody from NAMI or behavioral health, you can do that right through the website. The other thing that I always like to point out, again, just in case, there's always a red phone, unmannedtherapy.org on every page, and it connects to either 988 through, again, call, text, or chat, or Veterans Crisis Line. So no matter where you're at, if you're working through, I'm watching a video on anxiety, and it's 3 in the morning and I don't know what to do and I'm not making progress, you always have touch with crisis services immediately. So that's always something that I like to keep in mind. So this is great, again, for our students that are transitioning out of high school, staff members, and also kind of thinking too that on the prevention lens, which we're trying to get to that space, right? So on the prevention side, a lot of mental health issues are starting at home and seeing what parents are going through. And of course, coming out of the pandemic, we're all struggling to get back to a very normal routine and struggling coming out of that isolation. So this is a great resource for parents to have on hand. And it's a wonderful thing too for some of our caregivers. So a lot of times we'll see like wives or parents, and there's a page on mantherapy.org that will say like what to watch for, what to do if someone you love is struggling. So really great to get this into the hands of anyone we can so that they can start to keep an eye out.
Very good.
So thanks. I already have learned a lot today about what's available, so this is extremely helpful to me. So I'm a clinician, so I had to do some research to find out what resources were available. I thought there were 3 resources, but now I see there are more. I'm just kidding. But Aurora, I was in private practice until just under 5 years ago, and since that time, I've been with Advocate Aurora Behavioral Health, and I am very proud of what Aurora is doing. And Aurora gets hammered and knocked around because it's corporate healthcare, but we have some things in Wisconsin that are very special. For example, there are very few states that have the level of care for behavioral health that Wisconsin Aurora does. Illinois, part of the system, Advocate Aurora, they don't have it. North Carolina doesn't have it. Michigan doesn't have it. So, and the system has committed to what is happening in Wisconsin. So we have over 200 mental health providers, which surprised me. I didn't know it was that high. But that includes therapists, it includes neuropsychologists, it includes psychiatrists and nurse practitioners. And nurse practitioners are play an increasingly important role for Aurora. And so we're reaching more people. There are also groups that are available. Recently, Aurora and 4 other systems, and you guys probably know about this, but opened the Mental Health Emergency Center, which is basically an emergency room, which is staffed 24 hours a day by all of the disciplines, and it is unique. It is a new thing. It's working well, and police officers who are especially trained will often take people there. There's a psychiatrist on duty 24/7. So where do you get that? That's amazing, and it's a remarkable thing. And that's not just Aurora, but Aurora was a significant part of that, as well as 4 other organizations. And then there are some people within the system who have done incredible work in terms of reaching reaching out to underserved populations. I'll give you one resource that I discovered. I didn't know this existed. Advocate Aurora Community, advocateauroracommunity.org. One word, Advocate Aurora Community. It is a site that starts out by asking you what your zip code is, and then it goes to services that are available in that area under the areas of food, housing, goods, transit, health, money, care, education, work, and legal resources. It's an incredible resource, and so apparently we have had access to this for a long time, but I didn't know that, and it gets updated all the time. So it's a great way to help people and to have those resources available to them. The biggest problem, of course, is for us is availability, and we have therapists who are exhausted and have been working hard for a long time and trying to meet the needs of many people. Personally, I think one of the things that would be helpful would be if we shifted, and we are doing this within Advocate Aurora, but shifted to a model of treatment that is time limited. And there are many people who tell me that they thought that therapy was something you get into therapy and you never leave, and you just keep coming to therapy. Who watched Suits on television? Did anybody watch that? I'm embarrassed to say I watched the entire thing. And so it's
Don't tell me the end yet.
I won't tell you yet, but it's what's his name? The lawyer Lippman. What's Lippman's first name? Louis Lippman. Has his therapist that he has seen forever, and it's not like that. We need to limit therapy so we can serve more people. Aurora has done an excellent job in reaching out to underserved populations. The last data I could find was for 2017, 2018, but I believe that it's been similar for the years following, and that has been an investment of over $58 million for that 1-year period in underserved communities. That's really impressive, and it's something I'm proud of, and I'm pleased that they're doing that. And some of that is direct charity work. Others, for others, it's the Helping Hands program, and the Helping Hands program is something that I've referred people to, and they help people. And so, in one case, a young man who had lost health insurance and who got injured in doing tricks on his skateboard, and they wrote off his bill completely. So it's a great service and helps a lot of people. But they also do subsidized care, and then there are a number of other programs associated with that. Right now, we have something called the QTT program, which we are developing, which is the Qualified Therapist in Training. So these are people who are qualified. They have their degree, and they're now doing the final part where they're earning their hours to be able to do clinical work. And I'm supervising one of those people. They're carefully selected. They're amazing people, and they've picked good candidates. And this is a way to get more people on board and more people hoping. They are able to bill Medicaid, but that's not why we have them, and we hope they'll stay with us. But they're well paid, and they receive full benefits, and it's great for somebody who's just graduated, who is a good candidate and wants to go into that program. So I'm proud of that program, and there are stringent rules about how supervision is done. So I work very closely with my student, my QTT, and as I said, she has impressed me tremendously. There is also the Health Psychology Residency Program at Sinai, which is opening doors for health psychology, and then just something I didn't know about, the Maternal Addiction Recovery Center also at Sinai, something that is tremendously needed. One of the things that I really have appreciated is the translator services, and it's just incredible to have, I'm sure many of you have worked with a translator cart, but literally just to have the cart, come in press the button for the language and somebody pops up and provides translation services, which really, for me, is just amazing. It's something we would have had to schedule somebody and get them on the line, but now they're right there, and they're in the room, as it were, and we can do therapy. And I always found translation-based therapy to be difficult because I just felt I wasn't really connecting with the person, but this way, I'm right there with them, and we have a great connection. And that also goes for people who are deaf, so that includes those services as well. In terms of community engagement, there was a question about that, and I would just refer to what Lori does here in Burlington. And Lori does tons of presentations and with different speakers, and I think you do a lot yourself too. And that's a great way to just improve mental health literacy, and the ones that I've done with Lori, we've had a really great turnout. I don't do that for referrals, by the way. In fact, I always hope there won't be too many, and because I'm super busy. But people learn about mental health, and one of the things that I like to do in the work that I do with kids, I only work with kids, is to demystify what they're experiencing, so we can reduce the stigma. And one of my areas I love is obsessive compulsive disorder. And this morning I talked with some parents who are terribly worried about their child because she was virtually catatonic on Sunday because she kept repeating certain actions, and to be able to explain that this is actually very treatable, and that she's not abnormal in any way, but that in fact her brain was doing the right thing under the wrong circumstances, and they kind of got into a state of being locked up. And just to demystify that for the child is critically important. So yeah, education is hugely important. And so I look forward to some questions.
I don't know if the audience has.
I mean, I wanted to come to this tonight because of the teenagers that I'll be working with and the challenges they're facing. One, they may speak English, their parents only speak Spanish, and parents' expectations may be far different than the reality their kids are in. And so bridging that communication within the family would mean mom stops pulling her hair, and maybe kid could get to school and actually learn.
Yep.
So my goal is to look at all of these resources that you have and see how I can facilitate making that available to the students, but also to the families, so that they feel like there is a resource that they the parent called today and she says, my daughter is at home, she says she's not going to school, I'm already at work, I just don't know what to do, should I call the police? And so the parent could get injured at work worrying about her child being obstinate and saying she don't want to go to school. And then the child is saying, well, I want to do a shorter version of school. And me coming in and saying, you're in 11th grade, you're almost done. How can we make it any shorter so that you can see the light? So we just started that process today, so hopefully we can turn things around with that one student. But then I've got another family where the boy's father passed away, and he's in middle school, and he's living now with an aunt and uncle. And the fear of him going out and getting hurt because of how it was in their country is keeping him basically in the house where he can't even set foot out unless it's to go to school. So the teacher asked, could I talk to the guardians and see if they could, loosen the hold? And I'm thinking, well, I can say encourage them to let him out, but God forbid he goes out and he gets hurt. So how to approach that is, it's in the back of my mind, how am I gonna
kind of on the tail end with data when it comes back in that, you know, there's certain groups that have more family support than others, and that can lead to potentially a longer lifespan or less disease because you have somebody home taking care of your parents and grandparents, right? But sometimes what we don't see is that built-in fear, and the experiences that grandma and grandpa had and that their parents had being projected onto the kids and potentially, you know, causing some of these mental health concerns, inadvertently, obviously. It's fears that they had for good reason, but more than likely that child is probably totally safe, you know? So it's addressing, I think, multiple generations and multiple different areas of different cultures and belief systems, and it's a tough thing to approach at a population level, but it's something that we do keep in mind when we're planning moving forward on how do we bring services in that are, you know, not just increasing numbers and availability and accessibility, but making sure that it's appropriate and being aware that there are cultural differences that need addressed before, you know, being able to address mental health services. So I think those are great examples of students that we, you know, we want to get them in school, we want their test scores to be good. We have to backtrack and address those family needs too.
So I would be one that would be like, train me. I mean, I've got a master's in social work, but that doesn't mean that I'm approaching the situation in the right way, you know. And I am bilingual and I have the cultural background, so that helps, but how to combine it and apply it.
I mean, I'm a foreigner, Spanish speaker, I have a daughter, who's somewhat bilingual, but everybody has their own experience. I used to work for the Kenosha Unified School District, as a liaison for minorities. And I realized, and my experience in there is that most parents do not, and this is regardless of language and origin, do not have a closeness with their school. They think the school is where they send their kids to. They're 8 hours there, they get educated, they go home, and they're two different separate lives. So one of my main goals in those years was to actually create a report with the parents where they feel that there are not just me, but you know, people that they interact with, that they can trust them. Because if they can trust them, then they can trust their kids to them. And then if they can trust them, they can also trust their opinions and their perspective. And for most parents, and again, this is, I would say this goes across any parents, the biggest interaction with school is parent-teacher day. That's about it. And that's what, 15 minutes of your kid is doing well or your kid is not doing so well. Is what happens after that. So earning the trust of the student, yes, 100%. Earning the trust of the family, 200%. Because then it becomes a system, and it's not just two separate worlds. It's this world where this child is moving. Because for the student, there is no difference. It is school, it's their life, so there is not two different worlds. So, but the parents could be looking at it in a whole different manner. And I think that that's the main cultural aspect to it. That, you know, just to look at this as a global situation, not just as different sections in the life of the student.
Prior to coming to Wisconsin, I would say like 8 years ago, I started working in a county in Kentucky, and that was my goal, was to move from individual groups to a team approach. And so the parents, eventually they did away with the idea that their kids were being signaled out because they spoke Spanish. And then on the other side is, well, those parents don't care because they don't even come to meetings. But then the meetings were like smack in the middle of the day, when if that parent takes off, they don't have built up cushion time. And so both sides were looking at it in a negative way. So how to change that and see it in a positive way. So meetings became more accommodating to the schedule that those parents were working, because their schedules, their jobs are not always going to be something like where you have a sick day and you can take it off. But by the end of 7 years, I would say 90% of the population that I work with, they took ownership of their role on this team. So I've just started here, so that's my driving goal here. But I'd like to be able to say, these are the resources, how can we help you access them?
Yeah, and I would say, again, out of experience, I used to work for the school district, worked there for 11 years before I was a parent, and then I became a parent, and I have a 15-year-old and I've been going to school for a while. And what I realized is that when I was working for the school district, I did not realize the parents were working. And then I realized as a parent that the school district didn't realize that I was working. So that neither one of us are 24/7 available. And so, again, if we can make all this as seamlessly world, like where we interact, and we're not just trying to pull each other from resources, but to actually provide resources that it makes it easier, then I think that it will create a better response on both the families and the students' performance.
And I think a good point that you brought up too is just that trust building. So we're new to the school. My daughter is 6, so we're brand new to navigating parent-teacher interactions. But one thing that I realized, which I think I'm going into this with a pretty open mind, and having worked in mental health, we had a family crisis last year, and I notified her teacher and let her know this is what's going on in our family. And it was within a couple of weeks that I was hearing from her art teacher, who saw her once a week, or her gym teacher, or the lunch aide that happens to know her really well. It's like, she just isn't telling as many jokes. Like, oh my gosh, you guys are really paying attention. And I didn't think to include everybody, but that just built my trust in the school system, knowing that they are paying attention and that they are engaged and genuinely concerned and want to make sure she's great and that she can do her schoolwork, but also that she's okay at home. So we had that conversation, and it really helped me to feel more comfortable that, oh gosh, I should really let you guys in and let you know more of what's going on so that you can use that information while you're taking care of my daughter all day. And then the other thing I think to realize from the school end too is, I love the resource that Dr. Langley brought up, where you can actually look at some of these resources around food and housing support, it might be legal support, maybe other healthcare issues. And I know Lori and I have worked together for almost 5 years now, I think, and just knowing that the schools play a huge role in that. These kids and these families have major needs that go on well before we're able to directly address, I should say, anxiety, depression, some of our mental health concerns. And any way we can help to build that all into one system, it happens at the school typically. So I think the way you approach it, whether it's being a social worker or a teacher or public health, we all have our degrees and kind of our lanes that we stay in, but bringing in other trainings, so doing a QPR training or bringing in NAMI, or getting another license of some sort so that you have more of a breadth of knowledge is critical in the school system, because you guys do see it all. And I think that's why we're trying to just bring as much as we can and make it available to you. I would love to come in and help, but I can't be everywhere either, and I know you guys are stretched super thin, so the more people we can get trained and the more people that have this breadth of knowledge, the better off we're gonna be with these kids and families. So, and anything too, I'd like to open up. So obviously I mentioned QPR, but if there's things that you guys as a district are looking for, always let us know. And if we can't find a partner that's doing it, we'll figure out a way to get that to the county too. So it's anything we can do to help support.
I had mentioned before that I came in hopes to find resources, but also in the future have a night where families can come and hopefully bring their kids kicking and screaming, but be able to hear it in Spanish and be informed in Spanish. This is where you go. You're not gonna run in a circle, because we're telling you this is where you can go. I think that would be ideal.
One other thing that I've noticed, just in discussions with other partner agencies too, is we have these wonderful resources. I don't think it's a lack of resources necessarily in Racine County, east or west side of the county. I think we have amazing organizations doing amazing work. To to get people to come to those groups or classes or to engage, even when it's in a school building. Well, now you have to go to the office and to be the kid that is going to the counselor's office and then going to that after-school group and not wanting to necessarily bring attention to it. It's completely understandable, but I think integrating particularly mental health discussions as part of normal check-ins in homeroom or in health class and just making this a very normal conversation. Something I've noticed even just in our office at the health department is the more that I've talked about mental health and the more that the couple people I sit around me talk about their mental health or their child's mental health, and this is what my daughter's going through, my daughter went through the same thing, you start to see this ripple effect of more people talking about it like it's a very normal thing, and oh, that's the provider you go to, do you have a recommendation for this? And like, wow, we're really just discussing this like it's, you know, I have a sprained ankle and I need to go get an x-ray done, where would you go? And it's really important, I think, to just bring those conversations to where they are, so it's not up to, you know, even adults are wanting to go out and seek help. I can't imagine trying to expect a student to take that step to go to the office and engage in a group. It's tough. So as much as we can bring that into the classroom, and I know those teachers are stretched really thin on time too, but just trying to make it as normal and routine as possible is huge.
And that's precisely where we have programs like Ending the Silence, because then you don't have to do it. We can come in and do it for you, and then continue the conversation and try to maintain the conversation up. Something that Dr. Leonard said, that it's demystifying mental health. We at NAMI Racine County, we have a podcast, and just a couple of weeks ago, we released an episode with the Racine community video production, and they're high school students doing video podcasts. And we talked about mental health, and one of the topics that was interesting during the conversation was that mental health now is seen in a more positive way. It's much more accepted, it's much more in our language. This generation and future generations look at mental health in a different way. But recording an upcoming episode for the podcast, we also, I was having a conversation with somebody else who says, yes, but there's still a lot of stigma, and there's still a lot of stigma about certain mental illnesses. So the more that we can demystify mental illness, and the more that we can understand that we all need mental health. And this is something that somebody told me this, and I repeat it every time I can, because the fact that somebody lives with a mental illness doesn't mean that they're not mentally healthy. Somebody can be completely mentally healthy and still live with a mental illness. The two things don't negate each other. So anybody living with a mental illness who could receive treatment could not only recover, which is a probability, but also live a fulfilling life. So the fear of admitting that we might have mental health concerns, and you are in the school district, please do tell me if you do have had any mental health concern, whatever that might be, because stress, depression, all these things that we all live with them. If we just keep it on check, then obviously they will develop into something worse. And by not talking about it is how we keep them on check. And that's one of the things that I love about the man therapy program, which I find it the funniest thing I ever seen, but it's also very deep, and it's because because of the stigma, men usually do not talk about their own mental health, and that ends up building into something worse. So bringing these resources so that they become part of the regular conversation, especially with the upcoming students, I think is very important. And it will also give the staff an opportunity to learn things just in case you see something that is out there that you may have not seen before, and know who to call and what to do in those situations.
I think even if it's not a crisis situation, and just kind of learning kind of the signs that a lot of us think are very normal. I'm in my 30s and learning that a lot of what I think are normal behaviors or personality traits stem from anxiety. Like, oh, okay, that's a little bit late in the game, but we're learning, we're figuring it out. So if we can get these kids to recognize and to understand and have the tools to address those on the front end, by the time that they're getting into the workforce and addressing much more stressful problems, they're gonna have a leg up. So, I think making sure that, yeah, the kids know, but also the staff, that your teachers are aware, and I know a lot of them go through so many trainings to be able to identify, some of those warning signs and things like that, but having the conversations and letting the students know that they see what's going on, let's work through this, let's give you a resource, you can work through it at home, make sure mom and dad are aware, whatever that might need to look like, but yeah, the more eyes we have on it, the better, definitely.
It's one of the great things I think about schools is that we have social workers, psychologists, counselors present, and the children know them, and they don't, you know, because they're a friendly face, because they're a familiar face, then when someone does need help, it isn't like a weird thing to go with Lori, because everyone knows Miss Radke, and they know that she's a cool person, right? And so they're willing to go and then talk about things, and I think that's one of the pieces that once we start early on here, when we start talking about, you know, mental health isn't a bad word to talk about. Everyone has mental health. It's normal. It's who we are. That just because we bring up the word doesn't mean that it's like, oh.
Right.
It's one of the great things that we can do, and I think that at our elementary, in our middle, and our high, like we have people who are trying to push out and trying to be a familiar face. So when there is a need, it's not a bad thing. It's not a weird thing. It's another part of life.
I think-
I'm sorry.
I was gonna say, I think something too it gets a little bit overlooked with teachers, but I know we see this with our law enforcement, first responders, veterans, that addressing their own mental health is sometimes, there's a concern that, am I going to, you know, is this going to impact my job? I'm seen as an authority person, someone that people respect. If I talk about my own mental health or address my own mental health, does that somehow, you know, knock me down a peg where I'm not necessarily a respected authority figure anymore? And I think with education, it's the same thing. I'm supposed to be in charge of these students and teaching them and helping them grow. But if I'm taking care of my own mental health, what does that look like? So I think as we're, you know, trying to address, you know, the school staff and helping the children, it's also making sure that they're taking care of themselves and setting a good example. And unless we find a way to clone Lori, we need either more, right? That would be the best solution. But I think the more staff we can have trained, and hopefully not necessarily take that off your plate, but have the more support around that area, because we know the social workers have a lot to deal with right now, and the teachers have a lot to deal with. So I think we just need to spread that skill out a little bit so that everyone can be involved in it. And I know, again, from experience with my daughter, she loves her school nurse, to the point where I think we need to give the school nurse a little break. But this year her classroom is right next door, and she'll come home at least once a week. And, I know I talked to Nurse Tony today, and this is what we talked about. Okay, she's got several kids to take care of, but she has that go-to person now, that she knows that if she's feeling uncomfortable or if she's, you know, something's going on, she knows who to go to. So I think the more of those individuals we have, the better.
Yeah, I was gonna say, like, school is a community, and it's a safety net. When I was saying before that maybe for the parents are two different worlds, sometimes for the students this is the better world. So the fact that they can feel that, it's a great step forward into their better mental health and their development. My daughter, as I said, she's 15 now, so she went through the whole COVID thing in school situation, and I think that what was most significant is that I don't know if she became closer with her friends, but she became more in need to be connected. And she's my only daughter, so she was locked in with me, so I'm not really happy about that. So is that need of having people who understand you and who are at your same level. And one of the things, at least that's my experience with the schools, is that even the adults can make the students feel that they are at the same level, that they can go to them and trust them and be somebody cool, that you were saying. Because, I don't know if I know so many times you will not see this, but I have seen the difference that it makes having a school community that care for the students. I've seen that throughout the years. I have met all students later on in life, and it is very significant. The impact that one teacher, one counselor, the janitor one person in the school can have on the life of people. So, I mean, it's a tall, it's a difficult task, but it's worth it.
So, you know, you had mentioned the suicide rates amongst young people, especially girls, and I'm seeing that clinically. I never thought I would. I've only started seeing that in the last year with 9-year-olds with active suicide ideation and intent. And you know, the assumption was always that kids under 12 really didn't understand the concept of death, and you know, they weren't not that they weren't serious, but that it was far less likely. But it's not the case, and it's concerning. I don't know that it's going to go away. I think we might now have to recognize that this is a new era, and we're going to have to deal with this in a different way. And certainly a lot of education. But how do you talk to a child who's afraid of a school shooting, and when the adults won't take responsibility, you know? And so it's tremendously concerning to me when this happens at least a couple of times every month. I don't know what to say to those kids. So we offer support, we look at ways of coping, but it's, you know, the constant drills, the fire drills and the lockdown drills, and you can only say that it's the lockdown drills are also when kids are sick and they don't want anybody in the hallway because they don't want them to see the kid who's throwing up or something like this. You can only say that so many times. Kids aren't stupid. They know. So I think the world has changed, and we have to come to terms with that, and we have to be responsible as adults and in terms of our own advocacy and so on. I do want to say a little thing. I was very fortunate to go back to my home country, which is South Africa, for a month in July and August, and was able to see some of the things that are happening in the city of Cape Town, which, by the way, is a wonderful city. And if you ever want to go and see an absolutely incredible place, go to Cape Town. It's very safe, perfectly safe. And there are a few things that the administration is doing there that are, in my opinion, remarkable. So the one thing that has happened is there are these informal settlements that spring up. There's one right by the airport. So when you go from the airport into the city, you go right by one of these, you know, they're kind of slum dwellings. People just set up their homes and so on. So you know what the government's response was? Instead of moving them out, they electrified them. So you have electricity going into these settlements. Well, once you have electricity going in, things start to change. People come in and they build, you know, they can build a house there for $6,000. And they have plans for people to be able to afford a home within 7 years at an affordable rate. It's an expensive program, but electrifying it changes everything. And then in the city, with homeless people who are mentally ill, typically, they have an organization that is arranging tours, and they train them to be tour guides. So they go from begging for money to leading tours. And we did 2 of those tours, and they were wonderful. They were absolutely wonderful. One guy lived in the community that we were touring, which was Burlington, which is a Cape Malay area, Muslim area inside Cape Town. Absolutely beautiful. And the guy did such a great job. So they don't get paid. You don't pay for the tour. You just pay in tips. And they're funny, and they're proud of what they're doing, and they have a sense of self-esteem. And instead of the beggars asking for money, they sell them. They don't give it to them. They sell them a little packet of hearts for 1 South African rand, and their recommended sale price is 20. So they'll sell you these hearts, and they're very pretty, and they're like little stickers, and you can do stuff with them. And now they have jobs, and they're not taxed, and they're proud of what they're doing, and they'll have a conversation with you and ask you where you're from, and if they see you tomorrow, they'll talk to you again, and you know, it's just wonderful. So very proud of the city of Cape Town. You should go there.
I think that's a really brilliant point too, is that we can't address a lot of the mental health issues that the adults have and the children without addressing a homelessness, food insecurity, finances, I was listening to a podcast a couple weeks ago, and there's, money can't buy happiness, but it can buy a lot of things that provide security and safety and full bellies and just knowing that you have a place to go at the end of the day and that you're safe. So I think that's something that I know as simply within the health department and then in the planning of our community health improvement plan for the next several years, we are really taking a look at how, yes, we want to address mental health and chronic illness, and substance use has been a huge issue, especially in Racine County. But the underlying issue behind all of that is, all comes back to having a roof over your head, food in your stomach, you're safe, you're supported, and we can't really make the impact we want to make without addressing those items. So being very aware of that and knowing that that is a huge undertaking, we can't do it alone, and you guys can't do it alone at the schools either. So just know that that's something that we're aware of, and we're looking to integrate a little bit more into the plans for the next several years at the public health department, and of course working with our partners too. So.
Bernadette? Before we, I don't know how much time we have, but before we finish, I want to remind everybody, the first week of October is Mental Illness Awareness Week. We at NAMI, we have events to raise awareness, educate, and that's why we do this type of panels and why we just consistently talk about mental illness and mental health. The idea behind Mental Illness Awareness Week, among other things, is to make the conversation about mental health and mental illness an everyday situation where we can feel, that there's no mystery, we can take the veil out of it. There's no scary word. So I would encourage you to participate if you can somehow on Mental Illness Awareness Week. As I said, we have some events, prep, and we have our podcast. Let me allow to that. It's called Compassionate Conversations, and we will be talking about stigma on the next episode, which is coming out the Wednesday of Mental Illness Awareness Week. But again, the point of all this is that we can make this a normal conversation, just like we talked about any other. We talk about diabetes and blood pressure. So this is also one of those things that we need to learn to address as a regular issue, because statistics say adults 1 out of 4 live with a mental illness. Children or kids about 1 out of 5, but that doesn't mean that the other 4 are not affected by it, or the other 5. So at the end of the day, in any room, somebody's affected by mental illness. So it's an important mission for us to create a more compassionate society where these type of situations are not looked at as something negative, and that people are accepted for who they are, because we all have our own issues, and we try to address them the best that we can. And that's the whole point of having these kind of resources, that we can have the tools to address those issues.
Other questions or comments? Well, we'd like to thank our esteemed panelists and appreciate you sharing all your knowledge and information. It's been a very informative time together. Thank you very much.